Okay, blood and blood transfusions for our class here. All right, objectives. They have provided an overview of blood and blood products, discuss why patients may receive blood or blood products, describe procedures for administering blood or blood products, and provide an overview of transfusion reactions and nursing interventions. The hemopoietic system is immune response. Hemopoiesis is the manufacture and development of blood cells. Lymphatic system is the maturation of lymphocytes. Structures and hemopoietic system, bone marrow, blood, and lymphatic system. Structures continued. Blood consists of cells suspended in plasma. Pluripotencyl stem cells produce all blood cells in the bone marrow. Components of blood plasma is erythrocytes, red blood cells, leukocytes, white blood cells, and platelets. Thrombocytes form a loose blood clot. There's a picture of your red marrow, what it produces. You've seen that before in another class. The whole blood carries oxygen to the cells, distributes nutrients to the cells for energy, carries specialized blood cells and chemicals, and removes waste products from the body cells. Red blood cells are oxygenation. White blood cells fights infection. Plasma is the liquid component, contains the nutrients and proteins, and platelets used for clotting factor deficiencies. And then cryoprecipitate is the plasma product that assists in clotting. Blood has a limited shelf life. Components can range from 5 days to 1 year or more, depending on the specific product. Platelets must be used within 5 days. Red blood cells stored refrigerated can last up to 42 days. Plasma is generally frozen and used within 1 year. Fresh frozen plasma. All blood donations are listed for ABO typing, hepatitis B and C, not listed, tested. HIV, syphilis, HTLV, West Nile, Chagas, and platelet donations are also cultured at a collection. Safe products. The safest product is autologous blood. So, blood component therapy, product use alerts, and any other additional equipment used for many different therapies, such as replacing deficient coagulation factors, blood components, red blood cells, trauma, anemia, and surgeries, whole blood, open heart surgeries, and newborns. Platelets, oncology platelet patients receiving chemotherapy, cryoprecipitate for hemophilia, and fresh frozen plasma, massive transfusion, and burns. This is a list of types of blood components and fluid that is used. Ringer's lactate, or lactated ringers, restores circulating volume, replaces some of the electrolytes deficiencies in there. Not really good for blood components. Normal saline, this is the choice for blood component administration. Restores some circulating volume, vehicle compatible with administration of blood, good availability, low cost, and safe to use. Whole blood replaces blood volume and oxygen carrying capabilities in hemorrhage and shock. Not used a lot these days. They take and do the red blood cells, packed red blood cells, and then give them regular fluid to replace that, okay? They don't use whole blood a lot. Then there's platelets. Platelets are in packs of 20 to 50,000 per millimeter, and they usually give them in large amounts. Albumin expands blood volume in shock and trauma and burns. Fresh frozen plasma documented coagulopathy, restoration of clotting factors, and supplies plasma proteins. Cryoprecipitate coagulopathy with low fibrinogen and restores the fibrinogen. Okay. So blood groups and compatibility recipients. Here you see blood group A goes with A, anti-B, and that you can read those and that and go from there. So if your patient is O plus positive, okay, this is known as ABO system. It consists of 4 types of blood, A, B, AB, and O. For each of the 4 types, they also have an RH factor, a negative or positive. The RH factor is related to a protein that is on the surface of the red blood cells. So if you are RH positive, you have a protein on the outside of your blood cell. If you are RH negative, you are missing that protein. 85% of humans have a RH positive. Okay. Blood groups, 4% have A type blood, 9% have B. O is the most common, and that's 47%. AB is the least common, which is 3%. And then the RH factor is equal to 85% of whites, 95% of African Americans. RH negative is equal to 15% of whites and 5% of African Americans. So it's pretty unusual to have an RH negative. Okay. So, must have physician's order for a patient consent and a patient consent signed for giving blood. Pre-medication need an order. Tylenol, Lasix, Benadryl. Those are the ones that are usually given. Must have 2 nurses to check the ID and blood product. Assess patient heart and lung sounds and skin pallor prior to the infusion. Use a Y tubing or follow agency protocols for setup. Tubing usually good for 2 units. Check your facility protocol. Normal saline is the only solution compatible with blood. Others may cause hemolysis. All products use a filtered tubing system. Not all are on the pump. Stay with the patient the first 5 minutes to assess the possible transfusion reaction. Other vital signs taken at 15, 30, and 60 minutes. Then hourly until completed. Try to complete within 3 hours. Pump rate depending on patient condition. Blood administration, nice little picture here for you to look at. Evaluation. 1 unit of packed red blood cells should increase your 1 gram of hemoglobin or 3% of a hematocrit. Each unit of random donor platelets should increase the count by 5 to 10,000 per liter. If from a single donor, may increase as much as 50 to 100,000. So it's better to get it from one person. Complications of transfusion. Air embolus, that's possible. Hypothermia, that's possible. Citrate toxicity, that's because they put citrate into the bags of blood to keep it from coagulating. Hypocoagulation, that's one thing. So because of the citrate, it can get into your blood and stop you from clotting off as fast. GVH, graft versus host disease. Infection transmission. Delayed hemolytic reaction. Pulmonary microembolisms. Metabolic changes. Hypo or hyperkalemia and hypocalcemia. Those are some of the things that could happen. Allergic reactions, bacterial, hemolytic, febrile. Others not listed is taco and trolley and graft versus host. Transfusion reactions, they're immune mediated, are the hemolytic, febrile, non-hemolytic, urticarial, and anaphylactic. The non-immune mediated are the hemolytic, trolley, circulatory, metabolic, and embolic. Okay. Transfusion-associated circulatory overload, that is TACO, caused by pulmonary edema resulting from circulatory overload. Acute onset of hypertension, tachycardia, afebrile, so they don't have a temperature, rouse in the bases, and may have pink or frothy fulminating pulmonary edema. That would not be a good thing. Okay. Trolley, that is traumatic respiratory allergic lung injury, something like that. I can't remember right offhand. 2 working theories of acquisition: leukocyte antibodies, HLA or HNA, 2-hit model, underlying condition making them susceptible, patient at ICU. Bioactive lipids, long shelf life, increases bioavailability of lipids in plasma. Both increase the vascular permeability in lungs, leading to pulmonary edema. Transfusion related, that's what it means, acute lung injury. HLA or HNA, again, that's what the 2 most common. Occurrences is 1 in 1,200 to 5,000, possibly higher due to lack of reporting. More common in platelet products, but can occur in all products containing large amounts of plasma. Can occur within 1 hour, but up to 6 hours after the transfusion has been completed. Signs and symptoms of trolley can range from mild to severe. Respiratory distress may need intubation. Hypotension, dyspnea, non-cardiogenic pulmonary edema may have slightly brown fulminating edema, can be pink. Tachycardia, cyanosis, and a fever 1 to 2 degrees Fahrenheit. Okay, this is what it looks like on a patient before on the left and afterwards on the right with trolley. You can see the difference in the lung fields. This one here is white out because of the pulmonary edema going on. Okay, nursing interventions for a transfusion reaction. Stop the transfusion. Okay, assess the patient, changes in heart and lung sounds, vital signs, skin changes, and skin rash. Administer saline and keep vein open. Patent TKO rate 10 to 25 milliliters an hour. Administer O2, lots of O's. What can patient tolerate? Notify the MD and anticipate orders. Complete transfusion reaction form and notify the lab. Blood bank, anticipate additional blood work to be drawn. Blood transfusion, here is a list of the febrile, allergic reaction, hemolytic reactions. Trolley is over here on its own, and then the other types of things that you're going to do for your nursing implications. Okay? Whew. All done. All right.